Thank you.
Great, thank you. So Sam, you want to just wrap things up for us?
So after we've heard all these amazing presentations about the exciting things you could do with this data, we just wanted to end with how you as an outside researcher can actually access this and also do exciting research on your own. So there's actually two sets of data sets that we're going to be providing. There will be a public use data set, which you can access through ICPSR, and we expect to have that up and ready by June 2015. And you can go directly into their website to access that. The publicly used data set actually is going to consist of two separate data sets. We've been referring to the LEAF as the nursing home cohort, and also the separate data set for the IT workers, which we've been calling TOMO. This will be provided in SAS format, and basically it will contain many of the CAPI survey variables. It will be a merged wide format, which in other words is an individual level data set, and it'll contain information from the baseline as well as all the subsequent waves. And of course, we'll be providing codebook and documentation regarding key information about these data sets. We just wanted to briefly mention some of the general format. All of the values are time updated at each wave, except for the randomization and the treatment assignment variables. In other words, if someone changed jobs into a different site, we might include an indicator to indicate that the person switched jobs, but their original randomization and treatment assignment variable holds. And this is just some of the general numbers that, if you saw it in the data set, would kind of indicate what it means. For example, a dot is a missing or logical skip. The question didn't apply or wasn't asked. You can follow along with the 10% simple random sample that we have provided along with this workshop. Some of the key variables that you should look at is the respondent ID is named admin link in the data set. Whether or not they were part of the intervention is under the variable condition, and we clearly indicate the employee status with two variables, employee and manager. For LEAF, the nursing home, which is the randomization site, is indicated with the LEAF center ID. And the variables that we talked about for the clustering is the random cluster and the random block. I wanted to briefly mention that the characteristics of the sites and the level that we use for the balancing for the randomization is indicated also, so that you might be able to use this information if you're using a multi-level analysis. For example, the retention, turnover, and size were characteristics that were used for the randomization in LEAF, and you might want to consider how you want to include this in your own multi-level analysis. Very generally, the first two letters in each variable would indicate the module that's coming from. The series of letters after the underscore indicates the question content. The number indicates the number in the series of items about that construct. And if there's an R at the very end, it indicates whether the item was recoded or reverse coded by us. For example, for this variable, WM indicates that's the work module. Turn indicates that it's a part of the construct of turnover. 2 indicates that it's number 2 of the series of items on turnover. And R indicates that we actually reverse coded it. So this is something that you need to keep in mind as you work with the data set. Similarly, for these two constructs, which talk about psychological distress, the SCEM indicates that it's an employee talking about schedule control, and the DIST indicates that it's an item talking about psychological stress. I want to include that the I at the end indicates whether we imputed. So you might see a slight difference between these two variables in terms of the N and the mean number, the mean average value, and it's because the second one with the I, it does include imputed values. For TOMO, very similarly, the randomization variables are work group and study group. The variables are labeled differently because the level of randomization was different for both cohorts. I mentioned earlier that we did not indicate any change in the original variables in these data sets, but for some reason, a change did occur, as Kelly mentioned, in the actual TOMO cohort, that for some reason, certain groups were not invited or weren't quite randomized as we expected, we included additional variables in the data set that you would be able to include in your analysis and understand these differences, as well as to replicate recently published data sets from our own network. This is the variables indicating the TOMO merger announcement that Kelly also alluded to for the TOMO cohorts. I also want to mention that most of the variables in TOMO will be in LEAF and vice versa. However, not all variables are going to be in both data sets. And for example, this is one that's found in LEAF but not in TOMO, and it deals with violence in the possible workplace. For the restricted access data sets, it includes a broader array of information from the surveys. For example, the public use data set does not include detailed race or gender or occupational title. That would be available in the restricted access data set. The health assessment data from the dry blood spots, the week of sleep scintigraphy, the spouse partner interviews, the employees' children interviews, the daily diaries and salivary cortisol sampling, all of those variables are only going to be available through the restricted access. For that, we will be providing that information. It will be hosted through the IQSS Dataverse network. And there will be an application process, which we included a draft of the application in the handout. The finalized version will be available through the Work Family Network website. We're going to be asked as part of that application process for you to specify which data set you're interested in. As we mentioned, there is multiple data sets available through this Work Family Health Network. A very brief proposal of what you plan to do with this data set, whether or not you have sought and gotten IRB approval at your own institution, and for graduate students, a faculty co-signature is going to be asked. On our end, we are going to be trying to do timely notification. Once we receive this application process, we'll on our end try to look and see if there's any duplications from previous requests. And if not, we'll really try to expedite and get you the data set as soon as possible, which basically means we would give you approval, you would go into IQSS Dataverse, and with the approval code that we give you, you'll be able to access and download that. The approval, though, is going to be, we're going to ask for that approval to be updated annually, or if we do not hear from you within that annual year, that your access to the Dataverse will be discontinued. And finally, I want to end with our data availability. We've talked about this already. The public use data set should be available by June 2015. We're going to follow that up with our first release, which will include all the employee baseline CAPI survey data by July 2015. Afterwards, and we plan on doing our second release of data with the 6, 12, and 18-month survey data. And more detailed managers data, as well as the child diaries and the cortisol sampling, will be in our third release, followed by our fourth release of biomarkers and sleep scintigraphy. We'll also be providing the code for all the creative variables used in our publications, such as the cardiometabolic risk score and the sleep variables, and that will be provided in our fourth wave of release. So I really want to thank you for attending this training. Also, we're very excited to share with you this information about this data set. And of course, feel free to talk to us and ask us any questions. Thank you.